Welcome to Nurses Tamil. இன்னைக்கு வந்து drug toxicity and its antidote பார்க்கலாம். First one, opioid overdose like morphine. They will give naloxone as antidote. Naltrexone is used for preventing relapse reaction. Naloxone is used for antidote. For cocaine toxicity, we will give amyl nitrate as antidote. For benzodiazepine overdose, we will give flumazenil as antidote. For anticholinergic drugs overdose, we will give pysostigmine as antidote. Pysostigmine is the only reversible acetylcholinesterase inhibitor. For cholinergic drugs overdose, we will give atropine sulfate as antidote. For theophylline toxicity, we will give beta blockers as antidote. For alpha-1 agonist, we will give pentolamine as antidote. For beta-2 agonist, we will give propranolol as antidote. Propranolol are nothing but beta-2 antagonist. For calcium channel blocker poisoning, we will give glucagon as antidote. Glucagon is also used as antidote for beta blockers. For digoxin toxicity, we will give digoxin immunfab. For warfarin toxicity, we will give vitamin K as antidote. For heparin toxicity, we will give protamine sulfate as antidote. For aspirin overdose, we will give sodium bicarbonate with dextrose as antidote. For insulin, we will give glucagon as antidote. For paracetamol overdose, we will give N-acetylcysteine as antidote. The other name of N-acetylcysteine is mucocyst. For organophosphorus poisoning, we will give atropine sulfate as antidote. For atropine poisoning, we will give pysostigmine as antidote. For methotrexate overdose, we will give folinic acid as antidote. For ethylene glycol overdose, we will give fomepizole as antidote. For magnesium sulfate overdose, we will give injection calcium gluconate as antidote. For neostigmine bromide, we will give atropine sulfate as antidote. For isoniazid, we will give vitamin B6 as antidote. Usually along with isoniazid, vitamin B6 pyridoxine is taken to prevent neural damage. For mushroom poisoning, we will give atropine as antidote. For carbon dioxide poisoning, we will give hyperbaric oxygen therapy as antidote. For beta blockers, we will give glucagon as antidote. For copper poisoning, we will give D-pencilamine as antidote. For iron poisoning, we will give D-ferroxamine as antidote. For lead poisoning, we will give DMSA as antidote. It is a chelating agent. For arsenic poisoning, we will give dimercaprol as antidote. For acute mercury, we will give dimercaprol as antidote, but for chronic mercury, we will give N-acetylphencylamine as antidote. The universal antidote is activated charcoal, which is used for various oral poisoning. These are the important antidotes usually asked in AIIMS exam. Thank you.